Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in the Conversation with Cancer Expert series of video podcasts, we have Dr. Surbhi Sidana, who is going to talk to us about a major presentation she made at the International Myeloma Society meeting that just concluded in Brazil. And she's going to talk to us about Ciltacabtagene for relapsed refractory myeloma real-world experience. We're privileged to have her. Welcome, Surbhi.
Thank you, Ravi. It's my honor to be here discussing this with you.
So, can you give us a little context as to what exactly you did in this study that you presented?
Sure. So Ciltacabtagene, as the audience is familiar with, is an autologous BCMA-directed CAR T that was the second FDA-approved CAR T in myeloma. It was FDA approved in 2022. The label has now been expanded to earlier line use. But when we treat CAR T patients in a clinical trial, the criteria are so stringent. You have to be progressing, but not fast enough so that you can get a slot. You have to have perfect organ function, perfect counts. And so when this was approved, we were very excited with the results of the CARTITUDE-1 trial, 98% response rate, 83% CR rate, and a median progression-free survival reaching 3 years, right? But we asked ourselves, how will this translate into the real world practice that we all have where patients do not meet those perfect criteria? The average age of a myeloma patient at the time of diagnosis is 69. By the time they relapse, it's much later. They often have other comorbidities. Often the blood counts by the time they're heavily pretreated are lower. Performance status is not ideal. So can we treat our everyday patients with this therapy, and what kind of benefit or risks will they have with it? And that's why we put together this. It's a gigantic effort with over 16 centers involved from the US Myeloma Immunotherapy Consortium. So it's just not my work. I had the privilege of presenting this and putting this together on behalf of many colleagues. And we evaluated over 250 patients who underwent apheresis and then followed their journey forward to look at efficacy of Ciltacabtagene as well as safety and other outcomes.
So, can you tell us about the cohort of patients that you studied?
Sure. So we looked at 255 patients who underwent apheresis with the intention of manufacturing Ciltacabtagene. As the audience knows, the first step in CAR T is apheresis of lymphocytes to manufacture CAR T